We're here in Phillipsburg, New Jersey, and there's a lot of exciting businesses that are happening here. And right now we're over at the Roseberry Street, I guess it's called, Roseberry Street. And let's talk about where we're at. Tell us the name of the business here, the practice, and your name, sir, please.
You are at Roseberry Family Dental. It's on 224 Roseberry Street, across the street from Warren Hospital. And my name is Dr. Marwan Basil.
Now, you know, obviously it's a dental practice. When the minute we walked in here, Doctor, I mean, I just fell in love with the place. I think it's laid out really well. Describe it a little bit because it's very soothing. Obviously, dental work, maybe people get stressed out. So did somebody think about this and you want to get people calm before they get nervous?
Well, absolutely. Like you said, dentistry is a little bit stressful on some patients, but we try to treat people the way we'd like to be treated. So basically, we try to make it as easy as possible. We have separated here the business office and the waiting room from our operation and operatory and where we do the treatment. So there's very little noise that the patient waiting, they can't hear the drill. We have very latest equipment that are somewhat quiet or more quiet than we're used to. And we do all facets of dentistry, mainly cosmetic dentistry and family dentistry.
And we'll get more into that, but let me just ask you about the rooms a little bit. The pictures, everything on the wall, it's very calm. Talk about it, describe it, because it's kind of like an open concept, right?
Absolutely, it's an open concept because we don't want people to feel that they're like coming into a closed place or a closed room. We want to make sure feel as easy as possible. And we did great work on the decoration, on the renovation of the office. It's brand new. The last couple of years we did the total renovation. And like I said, we'd like to make the visit as friendly as possible.
Now let's talk about the type of dentistry. Obviously, if somebody has cavities or needs or whatever, you deal with that, but you deal with more than that?
A lot more than that. We actually do a lot of cosmetic dentistry here.
What does that mean? Describe that, because we hear that a lot,
yes,
but not everybody knows what that means.
Cosmetic dentistry actually involves the overall rehabilitation of the mouth with good aesthetic products, crowns, bridges, implants, veneers, whitening of your teeth. So basically we design smiles here. It's not only we do dentistry, it's basically we're designing smiles, and we'd like to basically emphasize on the dental health as well, because you can have the most beautiful smiles. If you have disease with the most beautiful smile, basically you're going to lose that beautiful smile. So we start from the dental health aspect first, and then we'll lead to a beautiful smile.
And that definitely affects your self-image, because the way you feel about yourself obviously comes from knowing all that's in order.
Absolutely. And we also do the invisible braces as well at this office. We do dermal injections for rings.
What does that mean?
Dermal injections are basically, it's a natural material that we inject to get rid of basically the wrinkles around the mouth, between the nose and the edge of the lips. We can do lip augmentations too. Some patients have, through accidents, damaged a nerve per se, and they have like a droopy lip. We can do a little bit of injection on that lip to lift it up and make it even with the other side. And that would be included into the cosmetic dentistry aspect per se, just to basically fix the teeth and fix what's around the teeth.
We're here with Dr. Philip Baldo, and Doctor, thank you for taking a minute to be with us. Tell us about the practice here, because you guys have an interesting thing here. It's really, really soothing when you walk in. I'm sure that's all part of the plan.
Yeah, we try to make it as comfortable as we can for the patients. We like to treat everybody like we'd want to be treated, and we feel like a nice, soothing, relaxing atmosphere would be comfortable for us and for the patients as well.
Now, it is dentistry we're talking about. Tell us about the kind of dentistry that you do here, because I know you do just about everything, but you also specialize.
Yeah, we do all family dentistry, from little kids all the way up to seniors, and we do everything from simple fillings to crowns and bridges, and we also do Invisalign, which are the invisible braces. We do Restylane, which is the dermal fillers, Bright Smile, which is the in-office whitening, and a lot of the brand names that you've heard of as far as dentistry goes. We do all that kind of stuff, and any kind of cosmetic dentistry as well.
Now, when it comes to ages, I guess you cater to all ages.
Yes. From 2-year-olds or when they're old enough to sit in the chair to adults, seniors, all the ages in between.
Now, when it comes to dentistry, sometimes there is some apprehension. I'm sure you've worked around that. You have ways of helping kids through it as well as older kids, adults. Talk about that for a second.
Well, we try, like we alluded to earlier, we try to make it comfortable for the patient. That comfort zone or that comfort area makes the patient feel more at home, and and relaxes them a little bit. We like to take their mind off it. We have TVs in each operatory. We like them to put the TV on, watch something they're interested in. That takes their mind off what we're doing. We just try to make it as comfortable and as homey as we can in a dental setting.
And when it comes to dental, I mean, how often should people be seeing you? I mean, obviously, that the answer to that is stay on top of things, right?
Right. We preach preventative dentistry. We do a lot of things to try to circumvent cavities and problems with your teeth. The American Dental Association recommends still seeing your dentist every 6 months, having cleanings, checkups, usually x-rays once a year. We usually check the gums once a year too to make sure you don't develop any periodontal disease or problems like that as well. So the simple answer is every 6 months or so.
And you're a great location. Tell us about where you're located.
We're right on Roseberry Street, right across from the Warren Hospital. And it's easy access from 22 and pretty nice parking lot in the back, and it's easy to get to.
Easy to get in and out. Are we leaving anything out when we talk about what you do here? First of all, it's beautiful. The colors, the pictures, everything is great. Are we leaving anything out when we describe what goes on here?
I don't believe so. The office you alluded to that is fairly new. We just remodeled approximately 2 years ago. So everything's fairly new and looks nice because it's been freshly painted and worked on. I don't think you left anything out. We stay up on all the data. We have digital X-rays to keep the amount of radiation down, and we do some things with laser dentistry to keep comfort level at a premium. It's just a nice, comfortable atmosphere with good, friendly people, and we like to treat you like we'd want to be treated. Basically, is the bottom line.
And in a final word, what should people think about? They're thinking about getting their teeth done, or thinking about brightening their smile, cosmetic dentistry, any of the above. Wrap it up for us. What should they be thinking?
Well, if they want top-of-the-line dentistry with friendly, caring people, this is the place to come. Come to Roseberry Family Dental to see us.